Thank you for inviting me here. My name is Sachiko Ozawa. I'm an associate professor in the Division of Practice Advancement in Clinical Education at UNC Eshelman School of Pharmacy. And I'm here to talk to you about childhood immunizations. And to ask the question, what's the value? What is the value of childhood immunizations? I'm sure many of you have children. You must have had them immunized at one point of their lives. What is the value of getting them immunized? Well, so globally, about 1 in 5 children worldwide still don't receive any routine immunizations. And what does this mean? This means that about 1.5 million children annually, every year, are dying due to vaccine-preventable diseases. That translates to about a population of Philadelphia dying every year, or 3/4 of the Research Triangle Park population dying from causes that could actually be prevented. So what do we do about this? What is the problem? The problem actually has to do with both the demand side and the supply side. So on the demand side, we have vaccine hesitancy. We see that in this country and in many other places where people may not be believing that vaccinations are safe and efficacious. We also have the supply side problem in terms of making sure that there's access to vaccination in many countries. So we've actually estimated what the return on investment is of giving childhood immunizations across 94 low and middle income countries over the current decade. That's 2011 to 2020. It's actually called the Decade of Vaccines, endorsed by the Bill and Melinda Gates Foundation, and over 10 different vaccine preventable diseases. And we learned that we actually estimated about $16 in return for every dollar invested in childhood immunizations during this current decade. And what we also see is that it's actually a really good return compared to some of the other things that one can invest in. This is based on a cost of illness approach where we calculated the treatment costs averted as well as transportation costs to get to hospitals and the lost wages as well as productivity that could be lost due to illness. We also tried another methodology where we looked at the full income approach. Now this captures the benefits of living longer and healthier lives. So we're now looking at the income growth as well as the value of life years gained during this period. And we see that we actually estimate about a $44 for every dollar invested in childhood immunizations. You really can't get better investments too frequently that could get you this sort of a return on investment. So for every dollar invested in childhood vaccinations, we're seeing a return of $44 in economic benefits. And what's really important to remember is that it's not just the children that are benefiting. You're actually making the children healthier, but also the community is healthier and the economy is healthier. And this could have large benefits that go way beyond what we're currently looking at in terms of immunization. I think it's really important that we think about how to raise additional funding toward vaccination, how to get both the demand and the supply side to work so that more children could get vaccinated. Now, these sort of estimates, evidence, generating these evidence is really important as well for many of us in this room who are involved in research because they could be really used in advocacy and dissemination. So for example, these results have been picked up in the Ministerial Conference on Immunization, the first one that took place in Ethiopia last year. It's also been picked up by the Melinda Gates Foundation's annual letter this year to try to make a better case for childhood immunizations. So I encourage everybody to generate additional evidence like this to make sure that we can promote and then disseminate in terms of implementation science, evidence that we know can really save children's lives. And I hope that you'll join me in promoting childhood immunizations and actually getting many of our own kids and kids around the world vaccinated.